Thank you, Georgia. Thanks for having me here today. How do I follow Alexis? So insightful. Thank you. Did you? Okay, so my name's Tristan Kluibenschadl. I'm currently a core trainer on the National Autistic Training Programme, as well as an expert by experience. I have a 32-year background in policing and the criminal justice system at a senior level, and a lifetime's experience of being autistic. I come from a neurodivergent family as well. My motivation to join the programme was to evoke change and to help integrate the autistic voice into that change. This following the death of my 15-year-old son, Stefan, who was failed so badly by services. We know there are many great professionals out there who do great work, who want to develop, who want to improve, and get things right for autistic people. These professionals support autistic people by adapting and improving their practice appropriately, learning from them what works for autistic people. But when things don't go well, things need to be challenged and reviewed in order to progress. And autistic voices need to be represented, and collaborative partnerships need to be developed and put into effect in a meaningful way to evoke that change. And the National Autism Training Programme aims to support mental health staff to get that right. We know that those who make a real difference are those who have modern training about autism and mental health, and who are committed to understanding the unique experiences and needs of each autistic person, and whose training is informed by the autistic voice. Today, I'd like to share 4 reasons why I think the National Autistic Trainer Programme is needed. 1, autistic people can live happy, healthy lives and should be able to get support when they're feeling unwell. There's evidence that many autistic people are not taken seriously when communicating distress or are denied therapy because they're autistic. This could be due to our different ways of experiencing and communicating distress, or due to myths that anxiety or distress are a core symptom of being autistic. They are not. Staff trained with us are able to learn from our curriculum about neurodivergency, about autism, and commonly co-occurring conditions. They also hear from us as autistic trainers about how we experience the world and what helps most to prevent crisis, why we may struggle, and what may help us. Of course, autistic people are not monolith. We're all different. And so being exposed to different voices and material co-produced with over 100 autistic people helps delegates get that full picture. Number 2, understanding how autistic minds work improves clinical outcomes. Our curriculum values evidence-based practice, but it often refers that evidence-based practice to research that may not represent autistic people of all abilities and disabilities. The autistic voice may not run through those manualized approaches. Our training represents that autistic voice and brings into effect current evidence-based research and developments. Many existing models of therapy could work for autistic people to help them overcome anxiety, depression, or trauma, if appropriately adapted. There is no one rule. There's no one manual on how to adapt therapies, and the one-size-fits-all approach and trap needs to be avoided. Autistic individuals' bespoke and unique experience and expertise of themselves, of course, is not taken into account. And theories such as monotropism, double empathy, alexithymia, and sensory processing are not necessarily considered when applying those manual interventions for anxiety, eating disorders, or when sharing sleep hygiene rules that may not work for them. Our delegates learn how to ensure that appropriate communication methods are established and offered to all diagnosed and undiagnosed autistic people. This has been reported as a key factor to access and to complete mental health therapies. Moreover, professionals attending the National Autistic Training Programme learn how to personalise their approach, to consider the preferences, needs, and experience of the people that they work with. Adapting the physical space as well as the approach means that autistic people can feel accepted and do not need to mask in order to pass as neurotypical, to access help, or to hide their need for help. Children as young as 10 years old express that camouflaging has already become a habit and that it was hard to stop. This is worrying, really worrying, as hiding one's authentic self and not being able to feel a sense of belonging is a leading cause of suicidality. Camouflaging is reported repeatedly to be stressful, to be confusing, and to be energetically draining. For autistic people of all ages, that is. We support mental health providers to understand how to create accepting and inclusive environments so more autistic people will be able to benefit from clinical contacts. Number 3, too often, too many autistic people are restrained and secluded because staff may not understand how to prevent this, or because organisational cultures may over-rely on those restrictive practices rather than on de-escalation and de-stress, and recognising visible and invisible stressors in the environment. Autistic people, when in distress, can exhibit behaviours of that distress that bring concern to staff and family members. There is strong emerging evidence that restrictive practices are not the answer. In fact, they are damaging and traumatising for people and often adopted as quick fixes or fear responses by professional staff. The knowledge shared during the National Autistic Training Programme demystifies what kind, reflective, and effective practice in terms of crisis could look like by discussing trauma-informed and stress well-being informed models, such as low arousal. To achieve that, community of practice discussions, specialist refresher days on reducing or ditching restraint and seclusion run a few times each year. Staff feel supported to reflect, plan, and share enablers and barriers as they shift into kind, humanised, preventative practices. The programme recognises that kind, trauma-informed approaches of to behaviours of distress may also improve staff mental health and job satisfaction. It's great to see within the training that mental health inpatient hospital staff, mental health staff from health and justice settings, as well as from residential special school settings, are included in those difficult yet crucial conversations, considering how to limit or completely abolish physical, chemical, and other interventions that may restrict autistic people instead of helping them to grow skills and improve their health. And finally, this is a train the trainer model. Qualified delegates have a wealth of material to explore and run with their teams to train them, with unlimited support until March 2025 from the National Autistic Training Programme team. The training has received excellent feedback and people have started to train their colleagues. The programme offers one-to-one on-demand support and mentoring, support in small teams to rehearse how to apply knowledge gained by the programme and turn that into everyday practice. It includes supervision groups, community of practice, and much more. This all can maximise the chances that the National Autistic Training Programme can invoke change and improve outcomes for autistic people and turn those ripples of change within settings into an ocean of change. Thanks for listening, everybody.